actually into,
Well,
yeah.
they're not gonna get 2 inches, and they're certainly not gonna go 30 times some kid, is it, you know?
But something may be better than nothing.
That's what I was
Yeah,
saying.
you do what you can, and you have to work with your own physical limitations. You know, it is, at some point, it is what it is, and you can only do what you can do, and that's why it's so important to have us on the way. So,
2 questions, Norm. I noticed that you didn't stop in the sequence between compression and breathing.
nope.
No, just go right through it.
Right, because what are we doing? What are we circulating? And that has to be a thought process. And we have to keep that blood circulating. Because once you stop doing compressions, there's been a lot of good science coming out of this stuff, and it basically takes 30 compressions to start getting the pressure up within the body. And that's why they want you to minimize that, you know, that 5 to 10 seconds, you know, for breathing, and that's it. Don't get hung up on the breaths. Keep those compressions going.
And the second piece was, when you notice the breathing is now done by the victim, when do you just observe?
Basically, you pause for that 5 to 10 seconds. Any signs of life, you stop. And then we see what's going on. Obviously, if the guy gets up and goes, "Wow, thanks," and walks away, beautiful. But generally, you might just say, you might hear him moaning, you might see the hands going, or he might spontaneously try to start breathing.
So you assess again and
You
repeat
assess and
the
see
whole
where
thing.
just see where you're at. Hang on one second. You got a question here? You got a question here?
I think I started telling you something. There's a tune that keeps the right rhythm of the compression, a song.
Oh, that's for you, though.
Or is that?
No, that's for you. Now, we'll segue into that. You know how I was kind of doing this?
Yeah.
Well, we are doing a rate of 100, meaning I'm trying to do 100 compressions a minute. Why 100 compressions a minute? Our normal pulses are 60 to 100. All of us. Some medicated, some not, some had coffee, but you're in that 60 to 100. So we shoot for 100. All right. This way, we're trying to give them the most that we can, but still doing an adequate compression by compressing all the blood out of it and letting it fill up again. All right. So you can pick a tune, and it used to be, you know, staying alive.
Yeah.
Or, you know, being a fireman, I do another one bites the dust.
That's very open.
I'm kidding. Kidding for the camera. So.
What's the legal liability?
Legal liability, as long as you don't do anything as long as you performed as the next reasonable person, they call it the reasonable man test. So as long, you know, there's no CPR police, no one's going to come check your card, but like you said, if the cops walked in and they saw her doing like 1 and 2 and 3, they're going to question it. They're going to say, hey, you know, that's not good. So basically, other than gross negligence, you know, anybody can sue anybody in the state, but as long as you perform within the guidelines and the best you can, and it was non-malicious, you don't have anything to worry about. Good question. That used to be the old, in a witnessed arrest. In a witness arrest, you can do something called a precordial thump. You got to be trained on it, but yeah, don't go punching. Yeah, don't go punching all the lawn guys. All right, we good so far?
Yeah.
All right, so. AED kits have something called a pocket mask, and a lot of first aid kits have them. And especially if you're still working or you're still in some capacity where you're working with people you want to help, but you don't necessarily want to do mouth-to-mouth. They have these pocket masks, and they're in a little case. You flip them out. This is just a trainer. The good thing about the pocket mask is that when you put it, you just have to make a really good seal, and your air is not going through their mouth and nose at the same time. Much easier than just pinching the nose and mouth to mouth. Right? So that's just something. That's just stuff that's out there.
So, Norm, say that again. The air with that one is not going through their mouth?
Well, I'm saying no. When you put a mask on, the air that you blow in is going through their nose and mouth at the same time.
Simultaneously.
Easier ventilation. Plus, there's a one-way valve in there. So if they do, you're not going to get their exhale there. And if they do vomit, you have protection between you and them.
They call that backsies. No
Exactly.
backsies.
Exactly. All right. Let's talk about 911 real quick. All right, so 911, and everybody will be able to appreciate where I'm coming from on this one. Basically, when you have a landline, if you still have a landline, as long as it's an established phone, you pick it up, you dial 911, and it comes up on the dispatcher screen in the city, the county, wherever you happen to be. Well, things have changed. That's cool, because if anybody's ever experienced their child calling 911, leaving the phone, or hanging up, you know, most agencies will send the cops out, send us out for a suspicious 911. That's great. The problem is, a lot of people got rid of the landlines. And what are they using now? Cell phones. So, if you use a cell phone to call 911, number one, you got to be very specific what city you're in. You need to know what city you're in, and I'll tell you why. The different carriers use different cell towers, and depending on where you happen to be, that location at that very moment, your phone call might go to another agency because your cell carrier's tower is closer. My son goes to FAU. I've trained him in all this stuff. We saw a kid have a seizure the other day, so he called 911. We have AT&T. We live here in Boca. He ended up going to 2 different agencies. He goes, "Dad, I couldn't believe it." He goes, "I got Boynton Beach Fire Rescue, and then they put me to Palm Beach County Fire Rescue." And meanwhile, the city of Boca was 3 blocks away from FAU. So when you call from a cell phone, be very, very specific. "Hi, I'm calling from the city of Boca Raton. I'm at 300 South Federal Highway at a business called this." And you got to be specific about it. Because if you ever see the fire trucks driving on 995, going one way, and then they turn around and go the other way, and then they turn around and go this way again? Usually, we call them passerbys. A passerby with a cell phone sees something. By the time they get through, they're in Boca. Let's say this started at Sample Road. All right, started down south. By the time they get through, they're at Palmetto. So where you at? Oh, we're at Palmetto. So now we're sending guys between Palmetto and Hillsborough and Palmetto and Glades looking for something that's not there. So you got to be very, very specific with cell phones. When you call, our dispatchers are what's called EMD trained, the Emergency Medical Dispatch. They can talk you through anything. So if you forget CPR or anything like that, they can talk you through it. You want to tell them what's going on, you stay on the phone with them. If you have your cell phone, dial 911, put it on speaker, and while you're doing compressions or whatever else, just start screaming. Say, "Hey, here's where I'm at, I'm doing CPR, I need help." Did that address the 911 call?
Yeah, that's what I wanted.
Good on that?
If it's from your house, you have a wire phone, you don't have to
Exactly.
know where you are.
Right, they'll know, but you still want to verify. Right. You know, worst thing, you call up and say, "Quick, I need paramedics at 600 North Federal Highway." Click. How many 600 North Federal Highways are there? A lot, a lot. So yes, we could triangulate, we could trace a cell phone. It's called triangulation, but it takes a lot longer. And they could come in. No, you just tell them what the medical problem is. You say, "My friend's collapsed, I don't think they're breathing," and they're going to say, "Do you know CPR?" They ask you to position them, and they'll talk you right through it.
But before, you had said when you call 911,
Yeah, well, no,
asked for.
I'm saying they're EMD trained. They're emergency medical dispatch trained. So as soon as you tell them what's going on, they have a flip chart, and they start taking you right through that flip chart.
But you say, there's a fire, or there's somebody down who's not breathing.
You call 911, you tell them what the emergency is. Don't call to find out what time the parade is, like they do every year. Don't call to find out about the weather, like they do every day. Civil matters, my neighbor, I saw him use my charcoal. They are so overworked in there, it's crazy. How are we doing? Everybody doing good on time?
Fine.
Okay. So questions on the regular CPR yet? All right, so let me put it all together from the very beginning, and then we'll introduce something else to it. So I come out at night, and there's that same guy from engineering, as I did CPR the night before. I look around, make sure the scene is safe. "Hey, you all right? You okay? You all right? You okay?" Quick, go call 911, get an AED. Checking for breathing, 5 to 10 seconds. No breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23,
Oh, wait a minute.
hands only. I don't know the guy. I don't have an adjunct with me. Do I?
You've done much more than 30.
No. Remember, I'm not doing any mouth to mouth. I'm doing compressions at a rate of straight 100. I lost count.
Is that almost as good?
Well, remember what I said. It's as good if you witnessed it, or if their downtime is very short, because there's residual oxygen in your red blood cells. If the person's been down like a half hour or an hour, they definitely need some oxygen. But like I said, that's a moral decision you have to make. Do you know them? Do you not know them? Do they got stuff coming out of their mouth? You know, there's a lot of stuff that you have to say to yourself, and all right, what am I prepared to do here? Sir?
So if you see him go down, you do the 30 and 2.
You have a choice. You have a choice. What they're saying, 30 to 2 is the standard. 30 to 2, 30 pushes and 2 breaths, that's the standard. What they're saying, something is better than nothing. So if you can't perform mouth-to-mouth, you don't want to perform mouth-to-mouth, or you don't have a mask, you can do the 100. If it's on a family member or anything like that, you're going to go 30 to 2, if you can. All right, cool? All right, so let's take this up a notch. So remember when I said, quick, go call 911, get an AED? Well, she didn't know what the heck it was, but she saw a sign that said AED located here. She opened up that little glass door, an alarm went off. She grabbed it, she came running over to me as I'm doing CPR, and I said, thank you very much. I got my AED on scene. AED, automated external defibrillator. They're all over the place. This is a trainer. First thing you always do, turn it on. Yes, they're in the bowling alley. They're at Publix. They're at Walmart. They're in the airplanes. It talks to you. You're going to be freaking out. You're freaking out. Stop for a second and listen. Close your eyes. It's going to keep repeating itself, like my wife, until you do what it tells you. All right, so if I was by myself, I stop my CPR for a second. I'm going to pull out my pads. There's 2 sets of pads. You have a set for kids and a set for adults. I call this firefighter proof because they show me pictures. Firefighters love pictures. I'm going to take off the first one, and just where the picture says on the left rib cage, hear it keep repeating itself until I do what it tells me it's telling me to do. I got the pads on, hands off, let it analyze. I don't want to give it a false reading. So now it's going to see if it's a shockable rhythm. There's only 2 shockable rhythms out there, and one of them's at VFib. All right, so that's cool. Shocks advised. I'm in charge. I make sure no one's around.
Stay clear of patient.
And they all do the same thing. They're all going to charge up. You can see that flashing orange button? I'm clear, you're clear, we're all clear. Boom.
Shock delivered.
They will leave the ground because they're getting a lot of amperage.
CPR.
Hear that beat? So unless the guy gets up and rips off the pads and goes, wow, that was great, thanks, you're going to continue with compressions. How many compressions? That depends. You're either going to do 30 or you're going to do 100. Hear that beat though? Now, you leave this on, leave the pads on. This is going to count down for 2 minutes. It's going to count down for 2 minutes. After that 2 minutes, it's going to say analyzing, hands off. It might be a shockable rhythm. It might not be. It might say no shock advised. It doesn't mean that he's alive. It just means that he's not in a shockable rhythm anymore. But we need to keep perfusing his brain, his vital organs by doing what? Compressions. Yeah, compressions, CPR. So do you have one of those homes? That depends on you. If you have somebody that's got a cardiac history, generally the people that I know that have these at home, they have somebody with a cardiac history, conduction problems, they've had heart attacks before, they've done it. Yeah, they come down in price a lot.
So Norm, just to review.
Yes, sir.
When the defib discharges into the body, that it takes 2 minutes to recover, to be doing it again, and then it goes through the assessment phase?
It's not that it has to recover. The protocol is shock, 2 minutes of CPR, analyze, maybe shock, another 2 minutes of CPR.
Okay.
So as long as this is a computer, which I'm sure all you guys can appreciate, and this computer is basically wired to recognize the 2 shockable rhythms, and that's it. It'll never shock on anything else. So this is what works. This is what's letting people walk out of the hospital having really fruitful lives after having a cardiac event, a serious cardiac event. All right? So remember, there's numbers. Turn it on and listen.
Apply pad to patient's bare chest.
And you
Plug
look
in
at,
pad connector next to flashing light.
look at the pictures. It tells me exactly where to put them on.
Apply pad.
It doesn't
Plug in
get more
connector.
firefighter proof than that. Right?
Now, Now, do you do the same thing for a stroke?
No, nope. I'll talk about the differences. I want to get CPR out of the way off the table, and then we'll start, then we'll punch it.
How many discharges?
It all depends on how many, it could go for a while.
It could.
Yeah.
But I have direct connector for
No, you don't have to worry about it. There's only two shockable rhythms. And that's what that is designed for, to recognize a shockable rhythm and a shock. You don't have to know what they are.
And it does go under the clothes.
You have to expose. I haven't heard that question, but you need to expose the clothes. You need to, expose the chest. I'm sorry, expose the chest, take the clothes off.
It has to go on the flesh. Right, on the flesh, right?
On the
Do
flesh.
not touch the patient.
And if it looks like they're wearing a sweater, and the AED kits, they're little razor blades, so you can carve out enough to put them on. Now, I've used this stuff on the beach, where guys look like a gorilla, and they were wet and sandy, and it stuck, so.
Deliver shock now.
I'm clear, you're clear, we're all clear, boom.
Shock delivered.
Is there an,
If that was a real person, yes, this is a trainer, so it's not sending out a real shot.
Is there an adhesive on those pads?
Yes, very aggressive adhesive.
So, but they're stuck together?
Well, this is a trainer, these are trainers, so don't go off this. The real thing, like if we were to take the real AED off the wall here and look at it, the pads themselves have expiration dates, and they're in a sealed, foiled, sterile container. And they get changed, they get monitored, and basically when you take it out, each one has its own backing, and you just
Pull up,
right, boom, boom, plug it in.
you gotta
ready to
pull
go.
a cover off.
Yes, this is all stuff we cover in the class. I don't want to go totally crazy on it, but yes, there are precautions that we have to watch out for if they're wet, jewelry, medication patches, anything that can conduct electricity will weld to the patient or create an arc that we have to be careful of.
Do they all have audio instruction?
Yes, except for the ones with mute people.
You press one for English or two
Except for
for
one's
Spanish?
How much do those cost in Walmart or wherever they sell?
They come down a lot. You have to go to like Phillips or Lairdale, things like that. And, you can get a home unit, basic unit anywhere from like 800 to $1,000 now.
Okay.
The thing is, in our city, if you have one, you have to have a prescription for it. Like I teach a lot of condos on the beach, so you have to have a prescription for it, and you have to show that your employees or your staff, whoever had training for it. They're trained with it. Sir?
Is that top patch near the pacemaker if you have a pacemaker?
If you had a pacemaker, then we want to keep it an inch away.
Down?
Inch down, just inch away. We don't want it right over the pacemaker or internal defibrillator. And if you see anything that's in there. Now, old school, some of them you might see on the right side, and that's where the pad's going. But for the most part, most of them are going to be here now. The majority of internal pacemakers and defibrillators are on the left side. So you will find some old school right side, so you just remove the pad away. This is all stuff we cover in our classes. All right, so I want to be, any questions on the AED?
Someone has a pacemaker, you may know because you see the incision,
Yeah, you'll see the lump coming up. Looks like a little deck of cards.
and you can still do this.
Yes, absolutely. Hey, you know what? They're dead. They're dead. And, if you ever heard life over limb, you do, the guy who cut his arm off because he was going to die in the rocks, he was mountain climbing, you do what you got to do. And, sometimes it doesn't go great, but it's life over limb, so we really don't care about the little stuff. It's just trying to follow the guidelines as best as possible.
Not recommended to buy a useful.
You do have to have a maintenance contract on them, and the thing is, the way the protocols change, every 5 years, the Emergency Cardiac Commission meets, and they go over all the statistics for CPR, defibrillation, and stroke, all that stuff, and they make new recommendations. Well, the last set of recommendations came out 2010. The rollout was 2011. The new recommendations are coming out now, and they said they're going to try and roll them out this November, possibly. We'll see. So and what happens with these AEDs, they need to be programmable. Because what happens, a lot of people took the real cheap way out, and they bought ones that are non-programmable. And if the American Heart changes the protocol, it used to be, let's say, 3 stacked shocks at the AED. And then years ago, they changed it to 1 shock, 2 minutes of CPR. Well, a lot of these AEDs out there couldn't be reprogrammed. So people wasted their money. So that stuff we look into and watch out for. All right, doing good. You guys want a break or?
Yeah.
Great.
We're good.
We're good? Okay. All right, so we did, any questions on the hands-only CPR and why we do it? Everybody knows the difference between 30 to 2. The 2 means we're breathing for them, or if we say the 100, that means it's hands-only. We're all good with that? Okay. I'll just hit this really, really quick. If it's a small kid, if it's a small child, remember, let's say a 2-year-old, all right? Pull them out of the pool, or anything like that. Everything's the same. All the steps we took are the same. Scene is safe, you're all right, you're okay. Quick, go call 911, get an AED. Checking for breathing, no breathing. Now if he's small, do I need both my hands? No. So one hand is just going to hold their airway open. The other hand, I'm going to do compressions. And I don't think too many people are going to have a problem breathing for the kid, right? So 25, 26, 27, 28, 29, 30. Put the head back, pitch the nose, open the mouth wide. Breath, breath, right back in. If your hand gets tired, if you have bad hands, just go to the second hand. It's cool, right? CPR police aren't going to come take you away. You're doing the best that you possibly can at the worst possible time in your life if you're going to be doing this.
Norm, what's the motivation? What's the motivation for one hand on the child's forehead?
I'm sorry?
What's the motivation or the reason for one hand on the
Because
forehead?
when you're doing, number one, CPR is violent, so the head's rocking around a lot.
Okay.
Number two, when you're compressing, not only are we squeezing the blood out of the heart, what else are we compressing? The lungs. And there's actually a negative pressure. And when you're doing compressions, if the airway's open, you're inadvertently going to be putting oxygen into their lungs. It also closes off the esophagus. So less air will go in there. That's a problem. All right, let's talk about stroke. If everybody's good with the CPR? You had a question, I'm sorry.
Yeah, if the child is small enough, you can cover the mouth and the nose with when you're
Yes,
pouring out,
yes.
right?
Basically, what he's talking about, and I don't want to turn this into a full CPR class, I just want to expose you a little bit. This is an infant. An infant is considered from birth to 1 year of age. We all know that infants change from those first few weeks to 2 months to 3 months to 4 months. But what is the same is that at the beginning they don't have structure between the nose and the mouth. So if you have to do CPR in an infant, you're only going to use 2 fingers in that middle of the chest because they're so small. And your mouth, you're going to open up your mouth, and your mouth is going to surround their mouth and nose at the same time. And you're just going to give them a puff of air, a little puff of air, because their lungs are so tiny. All right? So if the kid's like 9 months old, though, I've seen, 9 months old, this structure, you really can't pinch the nose off, though. So a lot of times you can cover the mouth and do mouth to nose. If that's not working, pinch the nose and do mouth to mouth, whatever. How do you know the air is going in the kid? Chest rise. And just enough. Like I said, you're going to be freaking out, but don't sit there and just keep blowing until the kid's floating away. It's only going to cause a lot of problems. All right? A lot of problems.
The biggest concern I would have with the child is one that just came out of the pool that was in there. Is all this the same?
It's all the same because if they would just take it out of the pool, chances are it was a near drowning or a dry drowning. What happens when people first drown, they have a laryngospasm. It closes off. They might go under the water, but the lungs stay dry for the first 10 minutes or so, 12 minutes, and it's the belly that fills up. So they get pulled out, usually just the motion of pulling them out, opening their airway, but usually either that first couple compressions or that first breath is going to put pressure on the diaphragm, and they can have that big burp. Water comes up, just turn them to the side, make sure it's all out, put them back on their back and reassess, see where they're at. Are they burping because they're coming back to life, or are they burping because you put pressure and they're in cardiac arrest? So that's what you're going to have to tell. All right, so let's go into stroke. Let's leave the CPR. So what is stroke? It's a heart attack in the brain. Actually, let me take 2 steps back. We discussed CPR, right? And CPR is for when the heart's doing what? Stop. And that's called cardiac arrest. Cardiac arrest. And I don't want to get personal. If you want to share, share. Has anybody here ever had a heart attack? Okay. You're still here talking to me, right? Did you go into cardiac arrest or did you just have a heart attack? So you see how there are 2 different things? Thank God. You see how there are 2 different things? A heart attack means a portion of the heart is not getting blood supply, oxygen supply, or the electrical conduction system is going wacky. That's a heart attack. People have heart attacks every day. You have the classic symptom heart attack, sweaty, you feel like crap, you have radiating pain, jaw pain, chest pain. Or you have the guys that go to the doctor and say, oh, they look at your script from last year, and they look at this year, and they said, you had a silent MI, a silent heart attack, because they saw the changes. They see scar tissue now. All right, so heart attacks happen every day. They do, but that's not cardiac arrest. So there's a difference between the two. All right, so everybody has that? You with me?
Like V-fib would be,
That's cardiac arrest. It's just quivering. It's just quivering. That's cardiac arrest. It's not doing anything. All right, so now let's take this into the brain. A heart attack of the brain. The brain is full of a lot of vessels, very vascular up there, a lot of arteries, and they serve all portions of our brain that help us function. Well, what happens is that you could have a couple different ways when you have a stroke. Either you could have a vessel burst, and then your brain is basically drowning in its own blood. You could have something get in the way, a piece of plaque, all right, where it basically gets caught in there. And now that part of the brain starts to suffer, and it always has that opposite effect. The person starts staring off into space. You might see the pupils going equal. Speech becomes impaired. There are certain telltale signs that we're going to look for with that, but that's what a stroke is. It's basically an attack. It's a brain attack. It's a portion of the brain that's not getting adequate blood flow for some reason. Either a piece of plaque, or an air bubble, or you've got a hemorrhage. All right? Hemorrhage, usually the turnout is not that good. Not that good at all, unless they're right there and it's during surgery, and basically they have them on the table, but once it goes, the damage is done. Brain cells don't regenerate that way after a hemorrhage. But somebody starts having the classic symptoms, and they call 911, and we get there, and we start interviewing the other person. When did this start? Well, I was talking to them, and as I'm talking, either they stop talking, or I notice a droop in their mouth. I notice their speech going off. They just couldn't walk anymore. You know, right side weakness. That's big for us because we have a window, and that window is about 3 to 5 hours. Quicker the better. But same thing, where we have the cardiac alerts. Now Boca has the neurological wing. You know, the Marcus wing that just got built there. And we have Delray, but I'd go to Boca hands down, one of the most advanced in the nation. But what this gets going, it calls the Neuroscience Institute. The neurologist lives right down the street, Markowitz, guy's excellent, and it starts getting that process going. So it starts getting the pharmacists going, it starts calling in the CAT scan people, starts getting all these different team members in. So when this patient's brought in, they go straight to CAT scan, they see exactly where it is. All right, there's the blockage, what's the time onset? We're within 3 hours, let's mix up the TPA, let's start pushing it, and they have been able to reverse the symptoms of stroke. And it comes down to time onset, and then what the physiology of it, where did it come from? Yes, sir.
how about a TEA?
I'm going to get to that. I will get to that. We got to spell it right first. TIA. So that's basically what a stroke is and the 3 different ways to have it. So what are we going to look for? All right. Number 1, we want to look for, we're going to use the acronym called FAST. F-A-S-T, FAST. You guys remember that? Facial droop. All right. Is there a facial droop at all? There's another acronym that's a little easier. All right. So facial, what's a facial droop? Have them smile. If you know when somebody smiles, you know what their regular smile is, and all of a sudden you see it starting to go down, that's a sign. Arms. Is there arm weakness? Have them put both arms out and close their eyes. You see one starting to drift? Another sign. All right. Speech. Is their speech affected? Is the speech garbled? All right. Is it different than it was? And then time. How long has it been? What's the time of onset? Has it been 1 hour? Has it been 3 hours? Don't be afraid to call us, okay? Men, put your egos at the door. Don't be afraid to call us. I've seen too many sad cases where they waited that 1 hour too long, all right? Spontaneous headache. That's the one usually with the, that's usually with the one with the aneurysm in the brain. Spontaneous headache, and all of a sudden they start going downhill. That's a bad one, all right? That's a real bad one. Now, so that's full-blown stroke. TIA, transit ischemic attack. You know what the difference is? The big ones come.
The big one's coming.
Big ones come. All right. People that have repeated TIAs will inevitably have a major stroke, or a CVA, cerebral vascular accident. Cerebral vascular accident.
And Norm, is that as a result of a vessel bursting, or is it?
It could be, it's just a warning sign that there's something going on up in there, whether it's a thrombosis, where there's stuff floating off the carotid artery that's getting caught up in there here. Because what happens, usually by the time we get there, they're starting to come out of it. And they're like, hey guys, what are you doing here? And I didn't call you. And then you got the family saying, you were just out of it. You know, for the last 10 minutes, you were out of it, you couldn't talk, you couldn't do this, you couldn't do that, and it finally passed. So that's what it is. TIA, transient, temporary, ischemic attack. It's a temporary loss of oxygen to the brain.
Are the symptoms more or less the same, or are they?
Symptoms are the same, but much quicker. Same, but much quicker. And usually you're going to notice it's going to be speech and a quick paralysis. But it's usually going to be the speech, and just as quick as it came, it goes.
You got a little numbness.
A little numbness. You've had it, talking from experience? Yeah, okay. Well, tell everybody then, because fortunately I haven't. I haven't yet. If you don't mind.
Pardon?
If you don't mind, tell everybody so they, you know.
Yeah, I was just doing my regular thing, and then all of a sudden I got this pain in my lip first, and then my jaw started getting numb, and then my heart rate started going up a little bit, and then I told her, and she took me to the ER right away, and they kept me in there and worked on me.
And it was diagnosed with TIA, or you had?
TIA, yeah.
Yeah, TIA. And you heard mini stroke. We all want to make ourselves and each other feel better about our ailments. So it's not a stroke, it's a mini stroke. Dude, it's still a stroke. You got to go on medicine. You got to go on something. You're going to die.
But they're going to show the same symptoms with the QGA also. But they'll be, speech will be garbled. They won't know where they are. They'll be disoriented. Won't have grouping, won't have lung movements.
Okay. But just look at the percent with a couple of them.
Other systems.
But we'll probably be able to discern that because of, you know, we use something called, we work with the University of Miami. We've been highly trained on this, and it's called the Cincinnati pre-hospital stroke assessment. And we go, and it's a 2-page thing where, you know, we just don't call stroke alerts because we're like, hey, I'm good, it's a stroke alert. We have to make sure, we have to document because it gets a lot of wheels moving, which equates to a lot of money, you know, spent. And once we call a stroke alert, we better make darn sure that we did our homework and we knew what was going on. So if that was the case, they probably would not meet the criteria in our pre-hospital assessment. So yeah, so we probably wouldn't call a stroke alert in that case. Yeah, and which we just call an altered level of consciousness, and then so we just check blood sugar and pressures and things like that. Sir?
Yeah, I should have added that after that, a little while after that, we were dancing and we were jitterbugging, and I got a pain in the chest. And I went to the hospital, and they were just going to do a test, but when they did the catheter, they looked and they said, you're going into the ER right now. And they did a quadruple bypass.
Oh man, you had the zipper.
Yeah.
You got a zipper?
Zipper
job, all right. Congratulations. I'm here to talk about it.
Right.
What are you trying to do to the guy? You gonna leave you a lot of money or something? Jitterbug. Come on.
No.
Is it protocol if you bring in patient, come in the ambulance, the hospital, all probability of stroke, all the symptoms are there? Is it the protocol to do immediate CT, because you got to determine whether
Yes.
it's hemorrhagic
Yes.
or ischemic?
Yep, they go straight
They
to
always do a
CT.
CT. How long does that take?
Very quickly. We'll roll them through the ER, and usually we'll just make a quick stop, depending on what's going on. If a stroke alert was called, we're rolling straight to CT. If it's one of those in between, ER physician's going to look, and then they'll make a quick assessment, and then they'll send them to CT. But yeah, that's the only way you're really going to know, is by CT. And especially
TPA is effective in even 4 hours after?
they just bumped it up. It used to be 3, and they just bumped it up to 5 hours. That we could call a stroke alert up to 5 hours now. And it's a moving target, and that's going to be based on research and stuff like that. But with the new neuroscience place there, I think we're going to see some really good statistics, really good stuff.
And the signs between men and women are still the same, it doesn't make a difference?
Pretty much, you know, it's funny. For stroke, yes. Cardiac, women are very, very different in cardiac. Sometimes women are very subtle, extremely subtle, where they just say a woman will complain more about stomach being upset and lower. So it starts getting the medics, and you start going in a different direction, where the males, usually straight up at the chest, you know, for this thing. I've been on toothaches, just a toothache. That was her only complaint, was a toothache. And she was having a major, major MI. So it's just, you know, it's detective work and then our diagnostic and stuff like that. And just, you know, kind of working with doctors and figuring it out. Good question, really good question. I feel like you have to teach paramedic courses. All right, so what is the acronym for if you want to diagnose somebody having a stroke or TIA? What's the acronym we're going to use? FAST. What does FAST stand for? F is facial, A, speech, A, arms, S, speech, and T, time onset. All right, so just remember that FAST thing. And it's pretty much all I've got. I mean, I could stay up here another 8 hours, but you guys are awesome. Thank you. Questions?
Unrelated to the health stuff, are there top incidences, causes of fire in a residential home that you all find? I mean, fire ants. Right, thanks.
It's a mixture, but most of the time it's going to be electrical. You got those strips, even though they say UL, we've had them for 25 years, you know, they're going to fail. You put enough stuff in there, they're going to fail. People who aren't very good with open flames and candles, you know, we all love candles, especially the holidays, but keep it away from everything, have it on the glass, you know, a lot of people
When
just,
you have a storm,
it's
put the
there.
candles out, and you don't have to open up the.
Get ones with batteries.
Just things like that. It's going to vary. Yeah, there's not just one thing. We've had a bunch of arson this year. We've had some kids playing with matches, and then we've had actual arson calls.
There's something about putting a yellow sticker on your car window. I don't, where do you get them, and it has something to do with your medical history or something that the people.
Oh, you know, there are different programs out there, and it might depend on the county or the city, but some people are doing it where they're keeping in their car a yellow sticker. It means that there's going to be medical information, let's say in the glove compartment. We started something, we had what's called a vial of life, and then we did the file for life. And a lot of times when we come to your homes, if you're by yourself, you're incapacitated, or your partner, really, sometimes we don't share things. You know, and we don't know, we can't find that little thing that you got folded up in your wallet into, you know, 18 little cubicles to open up. So inside this thing that we stick on the fridge, or you stick it in the fridge, it's your medical history, the medications you're on, allergies to medication, you know, past medical, so we know kind of what to go off on in your physician. So that's something you might want to think of.
Where can you get those?
Actually, I could get you a bunch through Sandy Savvy for your next meeting, or you could send them out. Boca Regional hands them out, and I could get a bunch of them.
Or if you can get me one of them, I'll put it in PDF format, and we'll just automatically distribute it to everyone.
Well, it's an actual pouch with a magnet on it we put on the fridge.
Oh,
and
great.
inside is a card that you fill out. And so when we walk in, we know to go straight to the fridge.
That's good.
We'll hand them out at the next meeting.
Yeah, or inside. I have an ambulance question. I live in West Boca.
Sorry.
So that would, apparently,
Not the city.
I am when I want to join a function, I'm sorry, too, I just get more money. But anyway, if an ambulance comes, it's not going to be from your district. What if they assess, God forbid, a stroke? Are they going to bring me to, or are they going to bring me to West Boca that doesn't take really West Boca?
Well, no, it's whoever's assessing you. They're bound by the same rules
They're
and laws and trained that we are. You live in Boca West community.
No, but I live
Okay.
in West Boca.
Yeah, so you're gonna get Palm Beach County Fire Rescue.
Right.
Same training, even though we're better. Same training. We'll go to school together. But they're gonna do the same thing. They're gonna call stroke alert, and they're gonna bring you to Boca.
To some or
Yeah, they're gonna bring you to the approved stroke center, the closest approved stroke center and approved facility for you. So So it's the same.
Well enough to ask.
Yeah. Oh, yeah, it's open for, just we're lucky that it's here in the city, but, if that's the closest appropriate facility, that's where they're going.
Thank
Yeah, good question. Any other questions?
How do you find out when you have the courses?
When I have the courses?
Yeah.
Bocafire.net, bocafire.net, and you click on community programs, and you'll see the CPR, and we also have the child car seat installation program that really took off big time. Bocafire.net. You guys know how to use computers? No. That's a bad joke. I've been dying for the last 3 weeks to say that. If you don't have any more questions, or you just want to talk to me privately, I'll be here, but thank you very much. You guys are very lucky.
Appreciate it. Not bad for a guy I met online, huh? A guy online, but don't spread that around as a guy online. I came by way of Norm through in terms of searching this as an opportunity, and one of the board members suggested that we have this stroke awareness or this CPR awareness, which I thought was a dang good, obvious, but a dang good idea. And we're going to post this on the website, so you're going to be able to reference this stuff and see the meeting. And it'll be available on the website as soon as we get it edited, put in the segments, and put it up on the website. So if you need a review of this stuff, you'll always have it there for an archiving too. And we're going to try to do a few more of these in terms of awareness stuff. The facilities here in Boca are fabulous, and we want to continue capitalizing on that stuff. Or if we can take some of these sessions and bring them up north as well, in the northern part of the area in Palm Beach County, North County, or in Martin or St. Lucie or something, we're going to try to do that too. But the participation seems like it's much better, the response is much better here. So, I thank you to Norm. He's got a wealth of experience. I really enjoyed this. Every time I go to these things, you really come away with a newfound respect. It really is a neat deal. So, unless there are some compelling pieces, go see the website for the next events that are coming up. And the next event is over at the train station, if you want to go over there, for $17.50. And there's a bunch of wine in my car. And we'll love to see you again. And thanks for coming, and we'll see you next time.
Oh, yeah. You look pretty good.
Gonna make a copy for everybody?